Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of March 8th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 81,000 cases and 1,293 COVID deaths. Here you can see that daily case rates continue to come down. And this is a relief as we are coming out of our wintertime spike. Unfortunately, case rates are directly tied to testing rates, which have also significantly come down. And so while I would like to be reassured about cases and case rates coming down, we also have to be mindful that these are actually tied to the extent to which people are choosing to get tested. When we look at the last 28 days, on average, our East Oakland zip codes of 94603 and 94621 continue to have the highest case rates in the county. And they are 4 to 5 times the case rates in some of the other zip codes in the county. And unfortunately, we also still have some of the lowest testing rates in the county. Here you can see the testing rates. And so if we are not testing at a high rate, then that means we are likely missing positive cases. And despite that fact, we are still seeing the highest rates in the 94603 and 94621 zip codes. So if we were testing more thoroughly, then in all likelihood, we would be catching even more of the positive cases. So at this time, we see that case rates are coming down, but we are also concerned about the slowing down of testing rates. And so one thing that we know that is consistent regardless of whether or not people are choosing to get tested is hospitalization rates. And so here you can see that our hospitalization as well as ICU hospitalization is also coming down nicely. But I want to put it in some perspective here. Back in October, when we were feeling like things were calming down at least a bit, we were averaging somewhere between 50 and 60 people per day in the hospital and between 15 and 20 people in the ICU. Right now, we are at double that rate. So it's important to keep in mind that even though we are feeling somewhat relieved because cases and hospitalizations and ICU hospitalizations and deaths are all coming down, we are still at about double the rate in terms of hospitalizations and ICU hospitalizations compared to where we were in October. So hopefully these numbers will continue to come down, but right now we are still in a bit of a tenuous situation. Luckily, we have good news that's on the horizon, which includes a third COVID-19 vaccine that was recently approved on February 26th, and that is the Johnson & Johnson Janssen vaccine. So how does this vaccine stack up against the mRNA vaccines, which are the Pfizer-BioNTech and the Moderna vaccine? So all of these vaccines target the spike protein. So when we talk about the mRNA vaccine, remember that that is an mRNA, which is the code for our cells to then make part of the spike protein. So then our body will create antibodies against that spike protein. And so when we are then presented with the real thing, we will already have the army of antibodies and other types of immune cells to fight it. And that mRNA has to be contained in that little fat droplet in order to get in. And remember that that is kind of a delicate molecule that has to be handled with care and stored in a very particular manner because it is not so stable. It actually dissipates very quickly once it gets into the body. But when it gets there, it gets into the cell and it makes parts of that spike protein so that our body can mount an immune response. Now, in the case of the Johnson & Johnson Janssen vaccine, this is using a different technology. What that vaccine is doing is taking an adenovirus, which is the sort of common cold causing virus, and it is taking out the part of the DNA that causes it to replicate when it gets in our body and splicing in part of the DNA that is coding for that spike protein. So it's some DNA inside of an adenovirus, which is a pretty tough virus. And that is able to go into the cell and it's not able to replicate there. They actually take out the part of the DNA that allows the adenovirus to replicate. But the DNA that has the gene for the COVID spike protein is spliced in and it goes into the nucleus of the cell and it makes mRNA that goes back into the liquid part of the cell. And from there, it's the same process as the mRNA vaccine. So the adenovirus DNA goes in the nucleus. That's where it makes this messenger RNA. And from there, basically, it's the same process as the mRNA vaccine, which in the cell will make the SARS-CoV-2 spike protein. And then that will trigger the immune response in our body, which is antibodies and a host of other immune cells that can attack SARS-CoV-2 if we are ever presented with it. So the Johnson & Johnson Janssen vaccine is only one dose, and this is a big advantage over the Moderna and Pfizer, which require a second dose after 28 days in the case of Moderna and 21 days in the case of Pfizer. Johnson & Johnson is able to be transported in a much more normal way as it relates to vaccines. It doesn't have to be at sub-zero temperatures. It can be shaken around. It's not as sensitive as the mRNA vaccines, which can't be agitated. They have to be stored very cold. And so there is a huge logistical advantage with the Johnson & Johnson Janssen vaccine in terms of both the distribution of this vaccine, as well as what locations will be able to administer it. It is also a big deal that it is only one dose because there are a number of locations and even some populations where this may be the best bet. And one example would be in the emergency department where someone is only being seen one time, or perhaps in shelters or other environments that may have more transient populations. So perhaps we're worried that we won't see the person again for the second dose. So there are a number of applications that I think we will be getting guidance in the future on when we would prefer to use one or the other. But in essence, most of those considerations are going to be mostly about the logistics rather than the actual vaccine itself. And I'll get into why right now. So these vaccines have all been pretty remarkable as it relates to preventing severe disease, hospitalization, and death. And I really think that the bottom line of the vaccine is that it makes it so that even if or when you get exposed to COVID-19, and even if you were to catch it, you are not going to die. So you get to catch COVID and not die. That's a pretty big deal for a vaccine to be able to do, and to do so completely, almost 100%. We don't like to say 100% too much in medicine, but the numbers are so overwhelming that when you get to 99.999, you just say 100%. So Moderna, Pfizer, and Johnson Janssen all give us that amazing protection against dying if we were to get exposed to or contract COVID-19. So that's the bottom line. And that's really what we want, because if you just get a little cold, you get a little cold, but at least you're not going to the ICU and perhaps dying from it. So that's a pretty big deal. Severe disease, also, all three of these vaccines are highly protective. And I'm going to talk a little bit about the specifics around Johnson & Johnson and some of the differences we're seeing. But I'll end off on this part by saying when it comes to mild to moderate disease, that we got a little spoiled with the Moderna and the Pfizer at the 94 and 95% protection. Almost unheard of when it comes to vaccines. And I don't think any of us would have predicted that we would come out with anything quite this effective. We're very fortunate. The Johnson & Janssen is completely respectable at 72% of preventing mild to moderate disease. And this really means that if you contract COVID, it's not going to be a death sentence. It's not going to send you to the ICU or to the hospital, but you could have some mild to moderate symptoms. And we will talk about whether that means you could then spread it around and how worried we should be about that. And I'll talk about that in just a moment. So the adenovirus, again, gets into the cells, but it cannot replicate there. It's a very different technology than the mRNA, but appears to be very effective. And one of the things that is important to keep in mind, even though I created this table and we're looking at these things right next to each other, this isn't exactly a fair way to look at these vaccines. And the reason is because the trials happen in different times, in different settings, in different parts of the world. We even had different strains, with the variants being present when the Johnson & Janssen trials were done compared to when the Moderna and Pfizer trials were done. And so all that being said, these are not head-to-head comparisons. It's not exactly apples to oranges, but it's like different, like Macintosh and Fuji. So we have to bear that in mind, that we're really not able to do this kind of a head-to-head comparison, even though our tendency is to want to be able to just compare the numbers and decide what's better and what's worse. I really would just encourage us to understand that these are not head-to-head comparisons, and there will likely be advantages with each one of these and disadvantages with each one of these, but none of them are to the level that would make us make a decision about thinking one was better than the other. So let's talk about the Johnson & Janssen study. So this was another very large randomized controlled trial, meaning half of the people got the vaccine, half of the people got a placebo. This was over 40,000 participants. And this was a very diverse trial with excellent racial and ethnic representation, even better than the mRNA trials. But let's keep in mind that the Johnson & Janssen trials were truly worldwide. The Moderna trials were exclusively conducted in the United States. And in the Pfizer BioNTech, the vast majority was conducted in the United States. About 76% was conducted in the United States. While in the Johnson & Janssen trials, 44% of the trial participants were in the United States. And the remainder of the trial happened in several countries throughout the world, including Brazil and South Africa, where we see a large percentage of the different variants that we are currently concerned about. So again, these are not head-to-head kind of studies. And the Johnson & Johnson, when we looked at how effective it is, we were looking at a larger percentage of the variants. And when it comes to Moderna and Pfizer, we actually can't say exactly how effective they are against those variants because they just were not very prevalent when those trials were done. So does that mean Johnson & Johnson is more effective against the variants? It's really difficult to say that it was effective, not as effective in South Africa as it was in the United States portion of the trial, but effective nonetheless. And I think that we believe we are going to see the same thing in all three of the vaccines, which is that they may have less effectiveness against some of the variants, but that in general, we are mounting a diverse enough immune response in our body with different kinds of antibodies and other cells that fight these infections, that even with the variants, it will still be protective, and that it's going to take more than what we're seeing now to completely avoid or evade the vaccine. Now, over time, that can change, and I'll talk about that more in a moment. Now, with regards to safety in the Johnson & Johnson Janssen trial, there was no increase in severe adverse events compared to placebo. But basically, the safety profile is excellent, just as it is in the Pfizer and the Moderna. Now, symptoms after the vaccine. And again, we try not to call these side effects because these are actually expected and anticipated reactions, and they are signs of an active immune response. And so we see that with the Johnson & Johnson Janssen, we actually have a fairly significantly lower side effect profile. Now, again, these aren't direct comparisons because we know that with Pfizer and Moderna, after the second dose is when most people are experiencing greater side effects. And with the Johnson & Johnson Janssen vaccine, there is not any second dose. And so this is specifically looking at first dose. And so as you can see here, the top four reactions are the same essentially in terms of what reactions they are. So injection site reaction, fatigue, headache, and muscle pain. And these are the top four reactions with all three vaccines. And as you can see, it's looking lower with the Johnson & Johnson Janssen compared to Pfizer and Moderna. But in all cases, the reactions last 1 to 2 days. By the third day, they're almost universally gone. And so it is just a matter of waiting it out those 1 to 2 days. And again, with Pfizer and Moderna, this is more often seen after the second dose. Not everybody experiences these reactions, but a significant portion of people do. And with respect to other symptoms, which occur in more than 15% of participants, with the Pfizer, we did see joint pain, chills, and fever. And with the Moderna, we did see joint pain and chills. And with Johnson & Johnson Janssen, there really wasn't anything significant that impacted more than 15% of the study participants. Now, what about stopping transmission? Well, we don't know this 100% for sure, and that is because none of the trials were specifically looking at whether they would stop transmission in people who contract COVID after getting the vaccine. The main endpoints were, would that person who received the vaccine get symptomatic COVID? Would they get very sick with COVID? Would they die from COVID? And once again, getting very sick and dying with COVID is pretty much eliminated with the vaccine. And really, that is one of the most remarkable things about it. And one of the serious considerations that I think every individual should be thinking about as we think about the fact that there is still a large number of COVID exposure. We are still losing close to 2,000 Americans every day dying from COVID. By no means are we out of the woods. And at some point, most of us are going to be exposed to COVID. So the fact that it does not have to be a death sentence and you can actually eliminate that possibility is a very big deal. Now, what about that 5 or 10 or 15% of people that may still get mild COVID? And furthermore, is it possible that more than that could actually get COVID and not even have any symptoms and then spread it around? And I think that these are valid questions for us to have because, again, the trial was not looking at that as a particular endpoint. And so some of this we are learning as we go. And what we are learning through a combination of different types of studies. This may be epidemiological studies, this could be through contact tracing, and this could also be through measuring the viral load that happens. But bottom line is the main way that we transmit COVID 19 is from having the virus in our airways and then expelling it out into the air, and then another person catches it. And usually through droplet transmission, but as we know, could be through aerosol, could be through surface transmission. But the way it gets there into the environment for another person to catch is that you've got it in your nose and you got it in your airways when you are COVID 19 positive. And even more so, if you are coughing and sneezing, then you're expelling those droplets out. And if they have a high number of viral particles, then you're more likely to infect someone. So there are a number of studies that either point to or strongly suggest that the amount of virus that is in your airway is directly correlated to what we call forward transmission. And again, these are a number of different types of evidence that have all been pulled together. And we think it all makes logical sense and everything is sort of adding up and pointing to the same thing. So when we get the vaccine, it decreases the viral load in the nose significantly. And when we produce antibodies, either because we got monoclonal antibodies or because we got the vaccine, then we produce different types of antibodies that actually go to our airways and to our nasal mucosa. So there are studies that have been able to show that there are different types of antibodies that basically clear out the virus from the nose and the airways. And this includes antibodies that get produced because you had the vaccine. So all of this being said, by being vaccinated, it appears that we are significantly reducing the viral load that will be in the nasal mucosa and the airways. And so that will just reduce your ability to transmit it. When you add to that the fact that you may not have any symptoms, you won't be coughing and sneezing everywhere, then you are also then not expelling those viral particles as well either. So even though we don't have sort of ironclad evidence at this point about exactly what the vaccines do about transmission, there is a lot of reason to be optimistic that vaccinated individuals will not be a significant source of spreading the virus. The other thing is that there are studies that show that the greater viral load you receive, so if someone sneezes on you and they're COVID positive and then you breathe that in, and I think this is logical, then potentially the sicker you get because you actually ended up inhaling more viral particles. And so there are some studies that suggest that the dose you receive, so to speak, also is correlated to more severe disease. So all that being said, I think we feel fairly confident that vaccination is going to decrease transmission, even though that wasn't one of the endpoints of any of these studies. So, what about the variants and how worried do we need to be about this? Will the variants avoid the vaccine altogether? And then we will be looking at needing a new vaccine and sort of this never ending cycle. And I think this is one of those things where it is going to be very important that we reduce transmission first and foremost. Remember, viruses mutate. That is what they do. These variants were not any kind of surprise. We know that viruses mutate every time they replicate. That is an opportunity to make an error. And that is all that a mutation is. And not all mutations are significant. In fact, most are not, most are irrelevant. But every now and then you get one that sticks and that actually ends up making it more virulent, makes you sicker, could be more contagious, it's easier to spread around. And these are not good things. But the way we stop variants is we stop replication. And the way we stop replication is that we stop passing it around, we stop transmitting it. And so our best bet really at this point is actually everyone getting vaccinated, or us getting at least up to that point of immunity across the population. And what percentage need to be immunized to get to that point is a hard number to necessarily pin down, especially when we are dealing with more contagious variants. And we are dealing with different vaccines that we don't know how long the immunity lasts. The immunity appears to be very long lasting with the COVID vaccines for the strain that you are vaccinated against. What about variants? And remember, this is why we have to have a new flu vaccine every year. There have been studies that show that when you get a flu vaccine, you are actually immune to that particular flu strain for your lifetime. The problem is it keeps mutating, and so every year you need a new one. But if that old variety came back around, you would already be vaccinated and you would already be protected against it. So luckily, COVID-19 does not mutate at the rate that the influenza virus does. It's much slower. But nonetheless, it is mutating and it will continue to do so. And that will be a direct function of how many opportunities it has to replicate, meaning how much it is spreading around. So decreasing transmission through all of the ways that we know, which now we know the best tool that we have in our toolkit, and really probably the only foreseeable way out of this pandemic is the vaccine. But there are a number of other layers of protection that I want us to always stay mindful of. Those are ventilation, filtration. Filtration can include filters in your air, central air HVAC system, in a HEPA filter, but also the filtration of the mask that you wear on your face. So the better filtration that you have, the more likely you are to stop spread. Also disinfection and sanitization, masking, spacing, testing, and quarantine. And when we think about all of these layers, we should also keep in mind that the more you have of one, the less you may need of the other. So if you are outside where ventilation is excellent, then you may need less filtration with your mask. You may not need the same mask that you would need if you were indoors with poor ventilation. And so we should always be thinking about all these different layers of protection, and vaccination being the strongest layer of protection for yourself. But again, not the only one. These others will still remain important, particularly until we definitively answer some of the questions around transmission. Now, who can get the vaccine and who should check in with their primary care provider first? So right now, both the Moderna and the Johnson & Johnson Janssen vaccines are approved for those 18 years of age and up, and the Pfizer BioNTech for 16 and up. And there are active clinical trials going on right now in the younger age groups, with the hope that we will have an approved vaccine for children coming soon. Now, there is actually no medical condition that prevents you from qualifying to get the vaccine unless you are allergic to one of the ingredients in the vaccine. It has to be a true allergy. And even then, this is something you should talk with your physician about and see if you are still eligible, with obviously the treatment available for allergies or anaphylactic reactions. But there are some conditions that would require some additional planning with your physician and discussion with your physician, or which could be either your primary care provider, but probably would be your specialist. Because if you have an autoimmune condition or a weakened immune system, and this could be from a condition that you have or from a medication that you're taking that affects your immune system, or if you have HIV, AIDS, you should speak with your physician. And here's the reason why. All of these groups that I mentioned, actually are more at risk of doing poorly with COVID-19. So we really want you to be protected with the COVID-19 vaccine because your risk of doing poorly is actually much higher because you may have a weakened immune system to be able to fight it. However, there may be some advanced planning that you'll need to do with your doctor to make sure that you are mounting the ideal immune response after you get the vaccine. So this may mean that you have to modify the medication that you're on. They may want to pause something around the time that you get the vaccine. So these kind of things can only be determined in partnership with your physician. So again, if you have an autoimmune condition or a weakened immune system, either from a condition or from a medication that you're taking, or you have HIV or AIDS, you should speak with your physician prior to getting the vaccine to make a good plan. Now, what about pregnancy? All of the medical associations that look after our pregnant moms are recommending getting the vaccine. And the reason is because pregnancy, unfortunately, can be associated with doing a little bit more poorly should you catch COVID-19. And the vaccines, although there was not large enough representation in the clinical trials to be definitive, now there are so many women who have received the vaccine. The safety profile, again, looked equivalent for pregnant women as it did for everyone else. Also, it does appear that the growing baby will benefit from also having some antibody immune response against COVID-19 as well. And then obviously we're protecting both mom and baby in the event that they were to be exposed to COVID-19. So for now, as it relates to these three vaccines, it's very difficult to compare them head to head. And because we are still in a situation where we do not have adequate supply and where COVID-19 is still circulating and causing a lot of illness and death still in this country, we think the most important thing to do is to receive whichever vaccine is available to you. So should you choose to get the vaccine, it is really not, there's really no compelling reason at this point to want to choose one over the other, with one exception, that if you believe that your chances of receiving the second dose are questionable for whatever reason, you're moving around, you're traveling, whatever the case might be, then that would be perhaps a good reason to get the Johnson & Johnson or Janssen, although we are telling everyone when you reserve your first dose, you are automatically committing to receiving your second dose on the mRNA vaccines. So whichever way, commit to getting the full amount of the vaccine that was tested and that will be required to achieve the level of protection that we have been discussing. But in general, any of these vaccines will protect you from dying. That's a big deal. Any of them will protect you from severe illness. That is also a big deal. And when we have enough people in the population vaccinated with any of these three vaccines, that is when we reduce transmission, we reduce replication. That means we reduce the number of mutations and variants that we will need to contend with, and that will reduce the likelihood that we will be needing to come out with boosters or updated vaccines in the future, although that is still a possibility and something that we will just be keeping an eye on. So until then, please mask, distance, increase ventilation in any indoor space, ensure proper filtration of recirculated air. This includes not only your filters of your HVAC, but also the type of filtration that you are putting on your face. Make sure that it is appropriately fitting any kind of filter, whether it's a mask on your face or on your HVAC unit. In the absence of windows or central air, purchase a portable HEPA filtration unit appropriate for your room size. Don't share your air. Mask up, space out. Always protect your elders and those with underlying conditions. If you think you were exposed, don't go to work. Don't gather. Isolate yourself. Get tested in 5 to 8 days. If you have symptoms, get tested right away. Continue to isolate until you get your results. Take a multivitamin supplement and consider additional vitamin D supplementation. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.